The majority of the surgery that I do perform, when required, is wide awake under local anaesthesia. Occasionally, I'll have to put a patient to sleep or put their arm to sleep with a block. But increasingly, I like to use local anaesthetic techniques without the need for a painful torniquet, which is like a tight blood pressure cuff throughout your operation. We can remove that now because we add adrenaline into the local anaesthetic. This gives me a relatively bloodless field that I can perform the surgery. It's particularly useful when I need biofeedback during the operation. And this may be, for example, if I'm doing a joint replacement on one of your finger joints. During the operation, I will ask you to move the fingers with the trial implant in place. If the range of movement's good and the implant feels stable, you can see the range of movement yourself if you want, well then that will be the implant we put in. If, however, it's quite stiff, without a good range of movement, I may want to resect a little bit more bone and then ask you to move it again. And we'll only put the definitive implant when we're happy on table that that's the right implant for you. If once we've taken some bone away, we've put the implant in, it feels a little unstable, well then we can perhaps put in a slightly bigger implant just to get the balancing just right. Wide awake surgery and the local anaesthetic with patient biofeedback is really good and important when we're doing tendon type work, whether this be a tendon transfer, moving tendons across the back of the hand, or repairing flexor tendons. On table, I can ask you to make a fist. I want to make sure the tendons are working well and there's no catching. If you're asleep, we just simply wouldn't get that biofeedback to be able to see whether the tendon's running freely or not. Once you've had your procedure, you'll be then taken back to the ward from where you came. If it's under local anaesthetic, well then you'll be on your way pretty soon after the hospital, probably within half an hour or so, once you have all your appointments in place and your post-operative medication. If you've had a general anaesthetic, the ward staff may want to keep you for a little bit longer. And generally speaking, once you're up on your feet, walking around, comfortable, you've had something to eat and drink, you've perhaps been to the bathroom, then you'll be fit for discharge. And then there'll be a variety of follow-ups. One of them may be with a nurse in a couple of days to reduce the dressing, but generally speaking, you should keep your wounds clean and covered for the first 10 days or so. You may be seen by one of my hand therapists for splinting or for cast removal and re-splinting. Or you may be seen by myself several weeks later for a telemedicine consultation or a face-to-face clinic consultation.